Hello everyone, I am Dr. Praveen Kumar Etta, consultant nephrologist at TX Hospital, Banjara Hills. Today we will discuss regarding edema because of kidney diseases. So first of all, what is edema? So edema is a situation where there is excess fluid in the body which causes swelling of the body. So it can be of different types depending on the site of swelling. So if there is swelling in the feet, it is called as pedal edema. If there is swelling in the face, it's called as facial edema. If there is distension of abdomen because of fluid in the stomach, it's called as ascites. And sometimes whole body gets swollen because of various reasons. That is called as anasarca, where the whole body gets swelled. So there are different causes for this type of symptom, that is edema. There are mainly four important causes we commonly see in clinical practice. First and foremost important cause is cardiac causes. So when there is a problem in the heart function, when there is a called left ventricular right ventricular dysfunction, it causes swelling of feet, especially that's called as pedal edema. So second important cause is liver disease. So when there is liver is not functioning properly, it causes mainly the swelling of the stomach, that is abdomen, that is called as ascites. And the third important cause is the kidney problems. So because of the protein loss, or when there is decrease in function of the kidney, it causes basically mainly the facial edema, where the swelling occurs mainly in the face, especially around the eyelids. So later on, it can occur in feet also, and other important causes like hypothyroidism and so on. So three important causes are mainly heart, liver, and kidney. These are the three important causes of edema. And edema broadly can be again subdivided into pitting type and non-pitting type. Pitting type means whenever you apply some pressure, it causes dipping. So if there is swelling in the legs, and if you apply some pressure, you can see some dipping because of the pressure. That is the common form of edema that we see in clinical practice. This is called pitting pedal edema. Another common cause is non-pitting. So non-pitting means it doesn't cause pitting. It doesn't cause depression whenever you apply pressure. It is usually seen in hypothyroidism, filariasis, lymphedema, and so on. So these are the broadly different causes of edema, different sites of edema. So before going to the actual topic, today's topic is on kidney causes causing edema in the body. So before going to the actual renal causes of edema, we'll just briefly discuss about the normal functions of the kidney. So kidney, what it does to our body. So kidney normally filters whatever the metabolic waste products, nitrogenous waste products which are produced normally in the body, like urea, creatinine. So kidney causes filtration of the blood, and it causes excretion of these waste products in the urine. So that is the most important function of the kidney. Other than this, it maintains the electrolyte balance in the body. It maintains the fluid balance in the body. It maintains normal serum osmolality. It is also helpful in maintaining acid-base balance in the body. It is also helpful in producing three important hormones, basically vitamin D, renin, and erythropoietin. These are the three important hormones that are produced in the kidneys. So kidneys basically, it maintains overall homeostasis of the body, fluid balance, electrolyte balance, acid-base balance, and overall body homeostasis is maintained by kidneys. So these are the important causes of kidney. So whenever the kidney function is altered, all these functions are disturbed, and it can lead to effect on different organ systems, including swelling of the body, that is called edema. So in the renal causes, the mechanisms of edema, basically there are 3-4 mechanisms are there. First and more important cause is because of protein loss in the urine. So when there is protein loss in the urine, it's called as proteinuria. So normally the urine proteinary excretion is usually 150 milligram per day. Less than 150 milligram per day is a normal protein excretion. So when it crosses 300, 500, it causes swelling. Swelling usually occurs in the face, as I told you, it is around the eyelids. So that's called the facial edema. So this facial edema is a common symptom of protein loss in the urine, and when the protein loss is more than 3.5 gram per day, it's called as nephrotic syndrome. This is the first and foremost important cause of edema because of kidney disease. Second important mechanism is because of reduced GFR. So GFR is glomerular filtration rate. So normally at birth the GFR is around 120 ml per minute. So when the GFR reduces, it's called as low GFR state. And if the low GFR is persists for more than 3 months, it's called as chronic kidney disease. And the chronic kidney disease is again divided into different stages depending on the GFR level. So CKD stage 1 is GFR more than 90 ml per minute, and GFR CKD stage 2 is when the GFR is between 60 to 89. GFR CKD stage 3 is less than 60, that is 30 to 59, and stage 4 is 15 to 29, and stage 5 is less than 15 GFR. So in this advanced stage of CKD, that is stage 5, when the GFR is less than 15, so most of these patients, they require dialysis or kidney transplantation. So these are the broadly the classification of chronic kidney disease depending on the GFR level. So when the GFR goes down, the body, the kidney filtration capacity also reduces. So this causes excessive accumulation of the fluid in the body. That also causes edema. And other mechanisms include water retention, sodium retention. Because of hormonal imbalance, there is activation of renin system. Aldosterone is another hormone. So aldosterone is excessively produced in kidney patients. So aldosterone causes sodium absorption from the renal tubules, from the nephrons. So all these mechanisms are important in causing the edema in patients with kidney disease. So kidney diseases can be broadly divided into two main categories. One is with protein loss, predominantly protein loss, irrespective of the GFR. Even if the GFR is normal, even if the creatinine is normal, if the protein loss is more than 1000 milligram per day, it can cause swelling in the mainly face followed by legs. And another important category is chronic kidney disease with low GFR. So even though when there is no protein loss also, because of low GFR, it causes edema because of salt and water retention. So these are the broadly two important categories of kidney diseases causing edema. So this is broadly the very brief description about renal causes of edema. So we'll go to the next symptoms and signs of edema. So in the symptoms and signs, edema can be seen obviously if there is excess water in the body by the tune of 3 to 4 liters in the body, swelling usually appears. When the excess water is less than 3 liters, usually you may not notice any swelling. So the threshold is usually 3 to 4 liters. When the excess fluid in the body is more than 3 liters, then you can see some form of swelling, usually the feet. So you can see the skin is stretched, shiny because of swelling, and you can, if you apply some pressure, there will be pitting type of edema. That is commonly we see. So how do you treat this edema? So for treatment options, you have both non-pharmacological measures, that is without medicines, and with medicines is pharmacological methods. So in non-pharmacological methods is mainly reduction of salt intake. Salt is the most important thing that increases the severity of edema. We advise the patients to take salt less than 3 gram per day in patients with edema. Normally, even normal patients also, the WHO recommended salt intake is only 5 to 6 grams per day. That contains 100 milliequivalents of sodium. But what we consume normally, even in normal adults also, usually it's 15 to 20 grams of salt we usually consume in our normal diet. So that is also very high compared to the WHO recommended value. So in patients with swelling, when there is swelling is there, we usually tell them to reduce the salt intake to 2 to 3 gram per day. If the swelling is much more severe, we completely tell them to stop the salt intake, because salt is the most important thing that increases the severity of swelling. So salt avoidance or restricting the salt is the first and foremost important point in non-pharmacological measures. Second is water intake. So we tell the patients to reduce the water intake even to less than 1 liter per day when there is significant swelling in the body. So salt and water intake are the two important things. Other than this, we can apply some external stockings kind of thing. We can elevate the legs to reduce the symptoms. And if patient is if the patient is having any heart problem or kidney problem, we have to tackle the underlying disease also. So coming to the pharmacological measures, that is using some drugs. So the first and foremost important drug category is the diuretic. So diuretics, what these drugs they do is they act on the nephrons in the kidneys. So they prevent the absorption of various electrolytes and water absorption from the kidney into the body. So by preventing the absorption in the kidney, they cause excretion of this salt and electrolytes along with water in the form of urine. So the two important categories of diuretics, we have loop diuretics and thiazide diuretics. In the loop diuretics, we have two important drugs. One is furosemide, another is torsemide. So these two drugs, if you compare, torsemide has more bioavailability and it is more potent and has more longer duration of action compared to the furosemide. For example, if you give furosemide 40 milligrams, it's equal to torsemide of 20 milligram, because torsemide is more potent, more longer duration of action, and this absorption is also much more higher. So in patients with edema, in patients with severe edema, we advise them to use torsemide instead of furosemide. Second category of diuretics, we have thiazide diuretics. So in the thiazide diuretics, we have mainly the metolazone, which is a very important diuretic along with the loop diuretics. We sometimes add both the loop diuretics and thiazide diuretics to cause more diuresis. And other categories of diuretics, we have potassium sparing diuretics also, mainly the spironolactone, eplerenone, and so on. So these diuretics, the first group of diuretics, that is loop and thiazides, they cause excessive excretion of all electrolytes including potassium. But the second category of diuretics, what I told, like potassium sparing diuretics, the important feature is they prevent the loss of potassium. They cause only the loss of sodium. So in patients, we can add all these forms of diuretics in combination to prevent potassium abnormalities, to prevent hypokalemia because of loop or thiazide diuretics. So these are the important category of drugs we have to treat edema. And treatment of underlying cause is also very important. If the patient is having protein loss, if the patient is having low GFR, that is CKD, we have to treat the underlying cause to prevent further progression of kidney disease, so that the edema it does not worsen. Okay, so this is a brief description about renal causes of edema and its management. Thank you everyone.